Welcome everyone to today's webinar, How University Health Started Their AI-Powered Automation Journey to Enhance Revenue Cycle Operations. I'm Marcus Robertson with Becker's Hospital Review. On behalf of Becker's Healthcare, welcome and thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation. We'll have time at the end of the hour for a question and answer session. If you have any questions throughout today's webinar, you can type those into the Q&A box you can see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser, and you can also submit any technical questions into the Q&A box. We are here to help. At this time, it is my pleasure to turn the floor over to Kelly to introduce our presenters and begin today's presentation.
Great, thank you, Marcus. And thank you all for taking time out of your day to listen to this webinar. My name is Kelly Leo. I'm Head of Product Marketing at AKASA. And our mission here is really to enable human health by using AI to build the future of healthcare operations. And we're doing that by starting with AI-based automation for the revenue cycle, tackling tasks from patient access to the business office, anything that can really help you all reduce your staff workloads, certainly streamlining time-consuming and complex tasks and helping you all capture more revenue. Today, I have Carrie Benshaw from University Health to share her story for how she got started on her automation journey. So Carrie, would you like to introduce yourself?
Sure, thank you, Kelly. My name is Carrie Benshaw. I am the Director of Patient Access and the Financial Counseling Center here at University Health. I've been in this role for about 5 years now and am proud to be with an organization. Our goal is academic medicine for all. So we'll talk a little bit more about that later in the presentation, but happy to be here.
Fantastic. Thank you, Carrie. So in today, we'll cover a few different things. We'll talk about the different types of automation that are being used, artificial intelligence, machine learning, robotic process automation, and discuss the nuances of each of these technologies. Then we'll share how to develop a framework for automation adoption, including setting goals, appropriate scoping, setting timelines, that sort of thing. Then Carrie will provide guidance on navigating staff adoption through collaboration, education, and engagement. And then we'll finish up with some key lessons learned and KPIs for measuring the success of automation in the revenue cycle. So certainly to kick us off, we're here to talk about automation, and it's really clear why our industry is so complex and challenging. The pandemic has taxed our industry, but it's becoming increasingly more and more challenging. As you see on the left, in a survey conducted by the AMA, 83% of physicians indicated that prior auth requirements have increased over the last 5 years. MGMA published a similar stat about a month ago for medical groups. In the middle, volumes are expected to increase, while inpatient volumes in the navy line may remain flat. What you see in the light blue line is outpatient volumes increasing by nearly 15%. And then as we think about this added complexity and the volumes rising, how are we going to solve this? Well, through our workforce. But yet daily, it seems like we're seeing articles that share data on increases in job vacancies, increases in job turnover, rising wages. Now we're dealing with inflation. It just feels like challenge after challenge piled on top of each other. I've been at a few conferences these past few months, and the resounding theme from folks I spoke with was like, help me with my workforce challenges. I have open headcount I can't fill. I have high turnover. I need to reduce costs. I'm seeing an increase in volumes, and I can't hire at the rate I need to. And so all this to say, certainly automation can be a key solution to helping you with these challenges. And when you hear from Carrie, you'll hear some of these challenges come to fruition. The increased volumes, the workforce challenges were certainly an impetus for Carrie at University Health as well. That being said, there are just different types of automation, and we tend to conflate these different types of automation, and not all automation operates the same. So I thought I'd just take a few minutes and walk through the lay of the land in terms of automation and healthcare operations. What you see on this slide, the most rudimentary but longest existing automation is robotic process automation. And there are use cases where RPA works really well. Simple, linear, repetitive, rule-based tasks. It has its place, but oftentimes is being shoved into areas that may be too dynamic or too complex for its capability. Just like cruise control on a car works best on a straight stretch of road, like you see here with little or no traffic, RPA is ideal for those more simple, static operational tasks. Tasks like claims batching, routing claims, resolving rules-based claim edits, all these things that are more instruction-based. So if you provide the recipe, it can follow it repeatedly. But then what happens if something breaks or experiences something not on the recipe card? It will require maintenance for sure. So then we're seeing the introduction of RPA and artificial intelligence. And this is like smart cruise control, where a car is programmed to run at a particular speed, like cruise control, but there's built-in intelligence that automatically follows the car in front of you and can vary your speeds accordingly. So definitely some intelligence that's built in. There are different subspecialties of artificial intelligence, and some specialties may be more valuable than others depending on the different use cases. So in this type of technology, we see this combo best being used for things like extracting data from insurance cards or training algorithms on data processing. And then lastly, we have the most robust set of automation. This is a combination of RPA, machine learning, and human in the loop. This type of automation is akin to self-driving car operating in a busy city, like you see here. Lots of decision points, lots of obstacles, pretty similar for the complex scenarios and revenue cycle that you all have. Machine learning is more of a subfield of AI. It can modify itself when exposed to more data, so it can teach itself. It's a learning system, and data is one key to training that model. The other key are humans in the loop. And so here at AKASA, we have what we call experts in the loop who have decades of revenue cycle experience, and they have two primary responsibilities. One is to train a model, of course, and then two is to step in if the machine encounters a scenario it hasn't seen before, solve that task, but then go back and train the machine again for that scenario. So this enables the machine to take on increasingly complex tasks over time while being flexible enough to ensure that the claims are still being processed without interruption. And certainly if something unexpected arises, it can be handled, making our automation very resilient. So we do this type of automation through our unified automation platform, and it can take on some of the most complex workflows. Things like auth requests that need medical record interpretation, or denied claims requiring corrections, or appeals that involve numerous decision points or courses of action. I'm sure you all can think of many unique cases that your organization deals with daily where there's just immense decision-making and multi-step actions needed that could not be programmed by a step-by-step rules-based recipe. And ultimately, when this kind of automation is fully operating, it enables the people in your organization to now focus on the most impactful areas to you, whatever that may be. It could be offering different types of unique patient financial services, serving as a patient advocate, ensuring that these people are operating at the top of their license so you're able to keep them and retain them. And so that's where we see the value of this third most robust set of automation. So now I'll turn it over to you, Carrie, to share how you recently started on your journey to automation.
Perfect, thank you. So first, we'll start off with a little bit about University Health. So we are the safety net hospital in Kansas City, Missouri. We are formerly Truman Medical Center, so we've recently rebranded to better show our tie with the University of Missouri, Kansas City, and to be able to show patients and everyone that our goal is to provide academic medicine for all patients, regardless of their ability to pay. And we are a level 1 trauma center. We had more than 1,200 traumas so far in fiscal year 2021. We employ about 4,500 staff members, and those staff members are crucial for us, and they truly believe in the mission and the patients that we serve. We have also had about half of all of the newborn babies born in Kansas City, Missouri. We have a brand new level 3 NICU that we're very proud of that we just recently opened, and we've just recently renovated our mom and baby unit, upgrading that facility, providing more private rooms. So we're very proud of those changes that we've been making within the organization. And sharing our patient mix, because this is really important to explain later why we decided to go down the path of automation. One of the more important things to note is the difference between our patient mix versus the typical hospital here in Missouri, specifically related to Medicaid. So a typical hospital in the state of Missouri would have about a 15% Medicaid population. Ours is 34%. And then the self-pay population, where a typical hospital would have about 6% self-pay, and our self-pay is 19%. So a very unique payer mix that really drove some of the decisions related to automation. One of the big reasons that we ended up making this leap was Medicaid expansion. So Missouri has gone through a very long and challenging road related to Medicaid expansion, but last year we were finally able to get that process completed. And so we knew that we were going to have a very large number of patients who were going to be transitioning from our financial assistance program or as a self-pay into expanded Medicaid. And not just Medicaid, but a Medicaid managed care plan. All of you know that managed care plans have additional dumps that you have to go through in order to get paid. And so those additional steps require manual intervention a lot of times, and we knew that that was going to increase our need for staffing and for people to be able to help with that process, in addition to those increased volumes. And so as we were preparing for that transition, we had several key players that were involved to make sure that we were making the right choice and moving down the right path. So our VP of Revenue Cycle was involved in that decision, me as the Director of Patient Access, our Director of Patient Accounting, our CFO, and our CEO. Really, with that group, it was to make sure that we had visibility into what we were doing so that they understood the path that we were going to be taking, that they could show their support in that decision and where we were going long term. And then to also give them some visibility into our successes so that we could look in the future in expanding the different areas that we were able to utilize the automation process. Also very important for us was making sure that we had a partner that could work well within our EHR. So we work within Cerner Millennium, and they actually were helpful in providing recommendations to us for different vendors that we could work with in this process, and then making sure that we also had their support throughout the process to make sure that things were working smoothly and to help us work out any kinks as we worked along. So really important to have a clear goal and timeline, and for us, that was Medicaid expansion. So our goal was to be able to manage what we knew we were going to have an increase in volume without adding staff to that process. And we knew that in order to do that, we were going to have some type of automation in our processes. and then working within a timeline. For us, that timeline wasn't quite so clear because Missouri Medicaid expansion, it went on a not so direct path, if any of you are familiar with that process. And so we had to adjust and shift and make sure that we were going to be ready when that they finally pulled the trigger and those changes were made. So with us, we started small, and we've been expanding ever since then. So we actually started the implementation process about July of 2021 as we were preparing for Medicaid expansion here. And we went live with our first product in late 2021. So I think it was November that we started with prior authorization. So we started with already a complex process in that we were utilizing the system to help us actually start the authorization, not just checking the status of the authorization. So we started in one work list, and we started with 3 specific payer portals that we were able to build that process. And then we expanded into our admission notifications. One payer there, that was a newer process for AKASA, that they understood the importance of that for us, and were able to build that into our scope as well. And now we are working on expanding those. That's where we are at this time, is expanding into additional payers, additional work lists. Within that expansion, we also had to deal with the challenge that we are in 2 Cerner registration systems. So part of our clinics and our acute care system is in the access management registration, and we have a larger amount of clinics on the ambulatory side that are in the CPM registration platform within revenue cycle. And knowing that our goal was to transition everyone into that CPM registration platform, we had to make some strategic choices about which of the prior authorization work lists we would work on, knowing that we didn't want to do double work and build them within access management and then build it again within CPM. So the importance of that is to know that that's a shift that we kind of had to make partially through our implementation, and be able to work with AKASA on that, and very helpful in making that shift over to focusing on our CPM work list so that we were ready for that. We are also working on eligibility. And with eligibility right now, we're focusing in on the pre-registration encounters to make sure that we get the right eligibility right off the bat. And then also working on some claim statusing for our patient accounting team. So with working with AKASA, one of the most important things for us is to make sure that we had a partner who was able to handle some of the changes that we knew that we were going to be dealing with. So changes within the payer portals, as the payers are building up their portals and making them more comprehensive, we knew that there were going to be changes about where a field was located, or maybe it's on a different screen now than it was when we first started. And making sure that we had a partner that could accommodate those and recognize that those changes were occurring. Also changes within our EHR. So within Cerner, as changes are made within the system, staff are making changes and they don't necessarily know that those changes could potentially affect our automation workflow. So being able to have a partner like AKASA that can also recognize those changes within our EHR and work within those without the process breaking, but being able to say, okay, this is different than it was yesterday. This is just something that we have to accommodate and we have to work through. So that human in the loop is really important to help us know quickly that a change has been made and not cause us unnecessarily delays or denials of authorizations because of a change that's made within been made within either a payer portal or within our EHR. And that one of the big benefits as well is being able to work within our unique circumstances. So AKASA spent a lot of time getting to know us, analyzing our data, analyzing our claims, analyzing our remits, so that they understood who we are and how they could best help us with our process, and then being able to deal with those complex processes. Like I said, we didn't start with the easiest of tasks. We started with actually submitting for the prior authorizations, not just requesting status on authorizations. And we started with admissions notification, which is, again, kind of a new process for AKASA. So we challenged them right off the bat, and they've done a great job at helping us through those things. This slide kind of shows a sample of our prior authorization production. This is the process that we started off with first in Q4 of 2021. And it just shows that even though we started off with 7 payer portals, they were able to work within all of the different health plans that worked within those different portals. So you can see there's a multitude of actual health plans that they're working on, even though it's just the 7 payer portals. And then showing the increase in volumes. So starting in Q4, volumes increased pretty dramatically in Q1 of 2022, showing how the system is able to work more and more accounts for us. And then Q1 of 2022, Q2, is really just showing April volumes. So that one will also increase as we work through the rest of this quarter. So this one is really about guidance on how to get staff prepared. For us, we had a pretty clear story. The story was that we wanted to be able to explain to them that we did not want to necessarily decrease staff, but our goal was to not have to hire additional staff as Medicaid expanded, and they work within those systems and those work lists every day. So that was something that really resonated with them. They could see how Medicaid expansion was going to affect our volumes and affect the number of admission notifications we were going to have on a daily basis and the number of prior authorizations that we were going to have to complete once those patients transitioned. So really important to be upfront and honest with what's the goal, where are we going, what are we trying to accomplish through this process. Communicating with them why and the big picture of where we're headed, and sharing the benefits. That really what we wanted to be able to do was automate those processes that are repetitive and save the more challenging, the situations that needed research, the more intricate types of situations for them to be able to manage as we work through this. And then AKASA really serves as a virtual FTE, so we're able to get more work done without having to hire additional staff and being able to support those additional increased volumes. Really important that your staff is involved and that they do have buy-in support into the process, because their feedback is crucial to making sure that the process will work. They're in the work list every day. They're in your EHR every day. And so they're the ones who are going to be able to provide that feedback if something doesn't appear like it's working, or if something in this system has gone a little wonky. They're going to see that very quickly, and their feedback to let us know, okay, this looks a little odd, or something may have happened with this encounter, especially during the implementation process, is crucial to make sure that those tweaks are made and the process is corrected as you work through that. This next part is really about engaging those other team members and departments who may have to be involved or who may be affected by the automation process. So for the admission notification process, our patient access team really initiated the notification, but then our utilization management team provides the clinicals and any follow-up to actually make sure that that inpatient stay gets complete authorization. Our utilization management team does not report up through the same director or VP as patient access. So being able to get their leadership team involved, explain to them where we're going with this process and why we were headed down that path, and helping them, because it was a big transition for them as well. prior to us using AKASA, that team was really doing the majority of their work through phones, faxing, more manual processes. And so we worked with them to walk them through the payer portal process and how to submit those clinicals online through the portal, and get their buy-in for what was a brand new process for them as well. So some of the lessons that we have learned throughout this process, and one of the things there are some key takeaways, making sure that you've got that two-way feedback. So getting that staff involvement, making sure that they understand that their feedback is crucial, and it's important that they tell us if something isn't working, and that they can say, hey, something seems a little odd here. And then having that communication with the vendor that you choose. We have weekly meetings with AKASA. Those are our regular standing meetings, but we'll also have specialized meetings as well in addition to that, if needed, to be able to walk through a specific process or a specific question that may come up. So being able to have that regular, quick communication on things that are going well or maybe not going well is really important, especially in the implementation process. Definitely important to consider the interactions between automation and your EHR. For us, having our Cerner partners involved in those weekly calls has been really beneficial, because they are able to provide us feedback on any barriers that we may run across. And it helps us to get things resolved a little bit more quickly by having those team members right there on the call. They can provide us feedback about what may have changed on their side of the house to maybe have why certain things have occurred, or to get us in touch with different experts within their side of the house to help us solve any problems that we may come across as we work through that implementation. Understanding your unique needs. So again, we have a really unique payer mix, so making sure that you have someone who can handle those nuances, handle those customized processes, and is willing to work through a tailored process that'll work best for you. This next one's really important. Realize that you can't just turn on automation instantly. I am a person, I like quick results, and patience is not necessarily one of my biggest virtues. So understanding that it's going to take time. It's going to take patience. It's going to be some trial and error. It's going to take feedback, and making sure that you've got that visibility and someone actually watching that process, and understanding that it's machine learning and it's going to take time to work through those bugs and those kinks is really important. So if you are interested in looking at an automation process, the sooner the better, because it does take a little bit of time to get everything set up and get it running the way that you'd like it to. Okay, and now I think I'm going to turn it back over to Kelly. Sorry, I think I jumped the gun on your slide there.
No problem. Thank you, Carrie. Thanks for sharing that information. You and the entire university health team have been great to work with. And as you were speaking, you mentioned a virtual FTE, and that's exactly it for us at AKASA. We like to think that our automation is a virtual team member to you, and so everything that you spoke to around communication and scoping and understanding nuances, I think it goes both ways, and just working alongside your university health staff, it's felt like a great partnership, and you all have been really communicative, so appreciate it. Just to finish up today's webinar, a lot of companies in Carrie's position, as you all are looking at automation or have started with automation, are asking, how do we measure the business value, right? So like many initiatives, it's important to measure the right activity at the right time. When you first start, definitely get your baseline data. That's absolutely critical, so you know your starting point. Then you'll be in a position to start to quantify the activity. So volume automated, hours automated, they're important because they're early indicators, and they can also help you achieve your goals, like managing increased volumes that you see coming into your organization. But as you progress, then you'll want to start looking at measuring the impact to your team. So measuring things like a reduction in time per task, decrease in denials, or an increase in clean claims rates, turnaround time from patient scheduled to your authorization being secured, working days out, right? Those types of metrics where you can support your team with automation and elevate their roles and responsibilities. And then you'll get to a place where you're measuring true outcomes to your organization. KPIs like reducing cost to collect, reducing days in AR, optimizing your revenue, increasing your revenue, really demonstrating impactful outcomes to your organization. We have another customer, Methodist Health System, located in Nebraska, who have worked with us across all these phases of automation. They've really been on this journey with us. And they did just this. They started by looking at activity. How many transactions were being automated? And in their case, it was 19,000 claim checks per month, which equated to around 19 FTEs worth of work. Then they wanted to look at staff effectiveness and productivity metrics. So they measured time per task. They measured a baseline of a little over 7 minutes per claim status task, and then measured it after automation to be a little under 1 minute per transaction, so an 86% reduction. And that enabled them to absorb some additional facilities into their system without needing to hire more staff onto the team. And then ultimately, they recently shared that the results of the work we've been doing with them has been an increase in yield. So their yield is up by at least 1% on a gross revenue of $3 billion, equating to the $3 million yield increase you see on the slide. So definitely a journey, but a lot of key metrics for you to consider as you look at and measure automation. I think this concludes sort of the slide content. I think one of the many takeaways I learned from Carrie today was that organizations should think about how best to integrate automation with your human employees. And so what do you need to do to get them on board, and how can you use automation to better support and develop them while simultaneously really helping your organization achieve its goals. So that's why AKASA looks at automation like that virtual team member, right? Part of your team who can not only tackle those complex use cases through the combo of RPA, machine learning, and experts in the loop, but can also really help to elevate the responsibilities of your workforce. So with that, I think I'll turn it back over to Marcus, and we will open it up for Q&A.
Thank you, Kelly and Carrie, for that fantastic presentation. And yeah, we'll now go ahead and begin the Q&A session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. And let's see, first question we got here, what type of staff resources do you need for implementation?
Yeah, so this is Carrie. So for us, we wanted to make sure that we had a good support team with our IT, within our IT support system. And then I'm certainly involved in the implementation and those weekly calls. We have one of our assistant directors who is also involved pretty heavily. And I will say that she is one of the best as far as eyes on the process every day to be able to make sure that the process is working smoothly. And then our frontline staff. So any of the staff who were involved with the prior authorization for that work list that we started with were involved during that implementation because they did some of the work logger videos to be able to identify those processes for AKASA. And any of our inpatient notification teams. So we had, I think, 2 to 5 admission notification team members who were involved in that process.
All right, excellent. I think this next one is for Carrie. Looking at your scope, how did you determine which payer to start with?
Well, we kind of had an idea of which payers we wanted to start with. We definitely wanted to work with those Medicaid managed care plans, knowing that that was part of our bigger picture goal. But AKASA helped us to validate that by looking at our claims processing and submission information, by looking at our remits, and helping to identify who our top 5 payers were. And it really matched up with exactly who we were thinking as far as those Medicaid managed care plans. And then some of our Medicare plans as well were in our top 5 list. So it was using the data that we knew internally from working those claims every single day, but also validating that with the AKASA team and the research that they were able to do on our claim submission information.
All right, thank you, thank you. All right, next we've got, let's see. Okay, how has your staff and your leadership responded to the automation?
Yeah, I mean, at first it was definitely tricky. They were nervous about it. I'll just be perfectly candid. Whenever you're introducing something like that, it kind of makes them wonder what's going to happen to me in this process. And so being very honest with them and explaining to them that we were not trying to reduce staff, fortunately for us, our goal was to try to help them with those increased volumes that they knew were coming, and they've responded very, very well. Our team has been, like I said, very crucial in providing the feedback and giving us that day-to-day information about what's working and what things need to be tweaked. They've done a fantastic job with that. Our volumes have increased, so that's helped that they've been able to actually see what we thought was going to occur actually occurring, and they are welcoming the assistance at this point.
Perfect. All right. Are these authorizations specific to IP, or does it include OP services?
Yeah. So with the prior authorizations, it is specific to outpatient services. So on the prior authorization side, we're definitely working with our ambulatory clinics and any authorizations that would be needed on that side of the house. But with the admission notifications, we're working on the inpatient observation. They're also checking on those observations for us to see if they're requiring a notification. So it varies a little bit depending on which product line we're talking about.
All right, perfect. Let's see. Next, we have got, could you speak to the support provided by and needed from the IT department? When did they become involved, if at all?
Yeah, they were involved right from the very beginning. So at University Health, our help desk, we actually outsourced our help desk functionality to Cerner. So their staff manage our help desk and work with us on larger projects like this. And so they were involved in the initial product or the initial project. We wanted to make sure that they would have staff available to be able to assist us through this. So their timeline was just as important as our timeline, making sure they had people available to help. And they have been in all of our weekly calls. They've been heavily involved in the process. Now, that doesn't mean that they had to do something every time and in every meeting. There wasn't necessarily action required by them, but at least having them available to listen in and hear what we're working on and provide any feedback or ideas or recommendations they may have has been really helpful.
Perfect. Okay, and I think last question we're going to have time for here. What other EMRs are you currently working with? Did that one come through?
Is that directed to Carrie?
That is directed to Kelly.
Sure. From an AKASA standpoint, we are vendor agnostic. We can work with any EMRs. That's the benefit of our automation, is that it sits on top of your installed or cloud-based software. So it can work with any of your workflows or EMRs.
All right, perfect. Well, yeah, like I said, that is all the time we have for today. Great Q&A session there. I want to thank Kelly and Carrie for an excellent discussion, and also to AKASA for sponsoring today's webinar. Please don't hesitate to reach out with any questions. Thank you again for joining us today, and we hope to see you at future Becker's webinars.
Thank you, Marcus. Thank you, Carrie.